Good morning, everyone. Our today's topic of discussion is faulty radiographs. Before we move on to our topic, we need to know a bit about what is an ideal radiograph. According to H.M. Worth, an ideal radiograph is one which has desired density, overall blackness, which shows the parts completely, without distortion, with maximum details, and has the right amount of contrast to make details fully apparent. It is indicated for that clinical condition. So to summarize, we can say it has optimum density, optimum contrast, minimum distortion, shows all the sharp borders, and has maximum details. We also need to know the radiographic requirements in an ideal radiograph. Primarily, the area of interest must be clearly seen. So, to bring the area of interest clearly in the radiograph, we need to ensure that there is proper alignment of the film and the radiation beam. The apices of the teeth in the area of interest must be seen clearly. The amount of bone surrounding the apices of the teeth in the area of interest must also be seen clearly. Prior to taking the radiograph, we must ensure that the proper selection of the film type has been done. The proper selection of the film technique to take the radiograph has also been decided priorly. So, moving on, now we will see what is a faulty radiograph. Based on these findings, we can say or we can define a faulty radiograph as one that lacks attention to details. It can lead to many problems. The images that are there are diagnostically suboptimal, therefore causing a loss of professional and patient's time. What are the causes of a faulty radiograph? The faults that cause the faulty radiograph can occur at any stage. For example, while taking the radiograph or during processing, while handling, storage, all these can cause a faulty radiograph. So we can classify faulty radiographs as follows. Firstly, faulty radiographs can be caused due to placement or projection errors. Faulty radiographs can be caused due to exposure errors. Faulty radiographs can be caused due to processing errors or due to storage and handling errors or due to any other artifacts. Now we will be seeing each of these errors in details. Firstly, the placement and the projection error. What are the various projection or placement errors that can cause faulty radiographs? First among them is overlapping of the tooth. The main reason for overlapping is when the film is not placed parallel to the tooth occlusal plane, or if an incorrect horizontal angulation is given. So to rectify it, ensure that the placement of the film on the lingual or the palatal surface is parallel to the occlusal plane. The central X-ray beam is directed perpendicular to the lingual, to the facial surface. To the facial surface. The next placement error is the apical end of the teeth is cut off. This occurs when the film is placed very close to the apex, especially in paralleling angle technique. In bisecting angle technique, if there is decreased vertical angulation, apices of the teeth are not seen, or due to improper placement of the film. To rectify this, we need to ensure that the film source distance is adequate, there is increased vertical angulation, and proper placement of the film in bisecting angle technique is there. When the occlusal plane is tilted, the main reason for this is the film edge is not parallel to the incisal or the occlusal surface. In the finger holding method, inadequate instructions given to the patient. So to rectify it, we need to ensure that 1/8 of the film edge extends beyond the placement. Next is the crowns are not seen or the specific area of interest is not visible in the radiograph. The main reason for this is the film is not correctly placed. In the mandibular teeth, 1/8 of the region is not extending above the crown portion. In the maxillary teeth, it is not below the crown portion. So a faulty placement. Decreased vertical angulation can also cause the crown surfaces not being seen. So we need to ensure that 1/8 of the edge is beyond and it is seen. Proper placement should be ensured. Adequate instructions must be given to the patient during the placement of the film, and an increased vertical angulation is also required. The next placement error is a cone cut. A cone cut occurs when the area of interest is not adequately covered. The position indicating device used did not cover the area of interest. In the finger holding method, the faulty placement of the film can also cause cone cut. So to rectify it, before doing an exposure, ensure that the occlusal edge or the occlusal plane is parallel to the film. Proper placement of the film has been ensured prior to exposure. Herringbone or the triad track appearance. The main reason for the appearance of herringbone pattern or triad track appearance in a film is the reverse placement of the film. That is, the occlusal dot is placed oppositely. So to rectify it, the pebble surface should be towards the cone or should be facing the cone. As you can see in the image, the first image shows the tire track appearance. The second image, you can see the V lines showing the tire track appearance. Occlusal dot placement. The reverse placement of the occlusal dot, as you can see in the image, the occlusal dot is seen towards the apices, whereas the ideal placement is towards the occlusal or the incisal edge. Shape distortion. This projection error can cause foreshortening or elongation. Foreshortening in bisecting angle technique is caused when there is increased vertical angulation. Whereas in paralleling angle technique, if the film is not parallel to the long axis of the tooth. So, in bisecting angle technique, ensure the accurate or correct vertical angulation. In paralleling angle technique, ensure that there is parallel placement of the film to the long axis of the tooth. Elongation. In bisecting angle technique, elongation occurs when the vertical angulation of the cone is not being correctly given. In paralleling angle technique, when the film is not parallel to the long axis of the tooth, the placement is not proper. So, increase the vertical angulation, place the tooth or place the film parallel to the long axis of the tooth. And before exposure, check the position of the cone. Image distortion. The main reason for image distortion is bending. In bite-wind technique, negative vertical angulation can also cause this image distortion. So prior to taking an image, ensure proper instructions are given to the patient about how to hold the film. You can also use position indicating device. This can cause reduced bending. While taking a bite wing, ensure you're using a plus 10-degree angulation. So this can avoid bending or the film distortion. Magnification. The main reason for magnification is because of the film to object distance is highly increased. So to rectify magnification, we would recommend the proper film to source distance being used. So moving on, now we have finished the placement and projection errors. We move on to see the next error, that is the exposure error. The first exposure error we'll be dealing with is double images. Double images occur when the exposure is given twice to the same film, sometimes even more times. So to rectify this, we need to keep the exposed images after each exposure in separate compartments. The next exposure error is blurred images. Blurring of images can occur when there is a movement of film or when there was a movement of the patient or the tube head. It can also occur due to increased number of exposures or double exposures. So we need to ensure that film positioning devices are used during exposure, or adequate instructions are given to the patient prior to exposure. You need to check the tube head before exposure, and separate labeled X-rays are kept in compartments after exposure. A low density or a light radiograph. This can occur due to underexposure. That is, the exposure time is too short. The source to film distance is very high. The kilovolt, the kVp is much lower, or the milliampere is much reduced. So to rectify all this, the adequate time of exposure should be there. Source to film distance should be adequate. The kilovolt and the milliampere should be as per the requirements. A high density film or a dark radiograph. Again, this can be due to the exposure parameters. Due to too long a time of exposure, the kVp and the milliampere were very high. The source to film distance was very short. The timer was inaccurate. So check the timer prior to exposure, set the timer correctly, reduce the kilovolt and the milliampere, adjust the source to film distance adequately. That was about exposure errors. So with this, we complete placement, projection errors, exposure errors. Next is errors that occur due to processing. Primarily, a light radiograph because of underdevelopment. Here, the developer temperature was too low, or the developer was completely exhausted, or it could have been contaminated, or a diluted developer, or due to excessive fixation. So to rectify this, we need to ensure that the darkroom timer was accurate or it has been set properly. The developer was replenished at adequate intervals or replaced at adequate intervals. The fixing was done for the required amount of time. A high density or a dark radiograph. This could have been because of overdevelopment. So the reasons could be too high developing, too much time taken for developing. The developer temperature as such was high. The strength of the developer was very high. Inadequate fixation, or it could also be because of an accidental exposure. So to rectify this, we need to set the timer right. We need to lower the temperature of the developing solution. We need to ensure that the developer has been replaced or has been replenished adequately. The fixation time has been standardized. We need to check prior to exposure, prior to developing, that there are no accidental exposures in the darkroom. A high contrast film. This occurs when there is insufficient penetration or due to overdevelopment or due to an inaccurate use of intensifying screen can also give us a high contrast film, or when the timer was not accurate. To rectify all this, we can increase the kilovolt, use the time temperature method, a low contrast film or a low speed screen film. Proper time can also be set. A low contrast film due to excessive penetration. It can be caused when there is underdevelopment of the film. Use of film having insufficient contrast. So decrease the kilovolt, replace the developer or replenish it adequately, regulate the time of fixing. We can also use a film with a higher contrast. The next processing error is reticulation or the orange peel appearance. The main reason for reticulations occurring on a film or a radiograph is because of sudden extreme temperature changes. It can also be because of weakened fixer solution. So to balance this out, we need to maintain a uniform temperature in the darkroom. We need to replenish and replace the fixing solution at adequate intervals. White spots and lines on the film. The main reason for white spots or lines appearing on film could be because of the presence of grit or dust, emulsion tear due to rough handling, the film contamination with fixer before processing, excessive bending, finger contamination. So to avoid all this, we need to ensure that the darkroom is clean and dust-free. It does not rub with, the films do not rub with each other against the sides in the hanger, and proper handling time, that is the proper developing and fixing time. Next is stains on the film. Stains can appear as yellowish brown or brownish stains on the film. This occurs when the developer or the fixing solution is exhausted oxidized or contaminated. It can also occur due to insufficient rinsing. To rectify this, we need to ensure that the developer solution and the fixer solution are replenished at adequate intervals. Adequate fixing time has been given. Adequate rinsing of the film is done after fixing it in fresh running water. Deposits on the film. This can also be due to exhausted or contaminated solution, improper mixing of solutions, or contaminated rinsing water as such. Adequate replenishment or replacement of the developing and fixing solution at regular intervals can avoid this. Ensure that you wash the film with clean water. A blank or a clear film. As you can see in the image, a clear film can also be slightly tinted blue film. This can be caused due to a faulty X-ray machine, a failure to align the film in the area of interest. The film was not exposed at all, or due to immersion in a fixer solution first before developing. So to rectify this, ensure that the area of interest is there in the film. Correctly give exposure during the exposure of a radiograph. Check the working of the machine prior or at regular intervals. Ensure that you dip the film in the developer solution first before proceeding on to the processing. A black film. This was caused due to exposure to light. So careful handling before and after exposure can avoid this error. Film density problems. As I mentioned before, low density light films. It can be caused due to exhausted developer or no agitation in the developer solution. The processing was too fast or the temperature was too low. So ensure that there is a fresh developer, the processing time was correct, and the temperature of the solutions were low or as per requirement. Pressure marks or scratch marks. All these can occur in automatic processing. In the automatic processes, scratch marks can occur when the foreign material or there is a rough spot due to improper processing or due to a damaged or a defective film. So to rectify this, ensure that the automatic processor is cleaned at regular intervals, gentle handling of the processor, compare with the films in the same batch. So if it was a fault of the film, you need to check it with the same batch films. Light spots again in the automatic processors are also due to dust, excessive bending, cracks in the intensifying screen, or due to finger contamination. So the dark room, the automatic processor, they should all be kept clean. Careful handling of the films should be there, ensured. Washing of the hands before processing and after processing should be ensured. The failure to transport a film can cause chemical contamination, dirty rollers, or incorrect drying. And this can also occur if there is no regular maintenance. So all these factors should be rectified. Next is the handling errors. After the placement, exposure, processing, we need to ensure that the film is handled with care. First one in handling errors is the scratched film. That is the white lines which appear. This occurs because the emulsion is soft and is removed from the film base by a sharp object. So the only resolution for this is a careful handling of the film. Overlapped films. A black appearance is due to the fixate, and a white appearance or the clear areas is due to the developer. This occurs due to contact of films either during developing or fixing. So to avoid this, use film holders and keep one film at adequate space. A developer cutoff. This appears as a white border on the film. This is due to the low level of solution of the developing solution in the tank. So to rectify this, ensure that the level of the developer is up to the brim and all the films are at the same level, dipped into the solution accurately or adequately. A fixer cutoff. Fixer cutoff appears as a black border. The developer cutoff appears as a white border, whereas a fixer cutoff appears as a black border. This is due to the low level of the fixer solution in the tank. So here we need to ensure that the fixing solution is at the brim of the tank or at the adequate level and all the films are dipped into the fixing solution completely. Air bubbles. Air bubbles appear as white spots. Air bubbles are caused because the air is trapped on the film surface after the film is placed in the processing solution. So to avoid air bubbles, gently stir or agitate the film racks after placing them for processing. Emulsion wash away. This can be due to prolonged washing. So time your processing accurately and you can avoid the emulsion wash away. The other artifacts that can cause a faulty radiograph. Primarily, when there is a dental appliance or foreign bodies. Dental appliance should be removed whenever they can be removed. Prior to taking a radiograph, ensure that the patient has removed his or her glasses, the nose rings, or any other objects that can give a artifact. Avoid writing with pointed or sharp instruments on the radiograph. This can cause black lines on the radiograph. Random artifacts can be causing contaminations. Use a marker pen instead of the sharp pointed pens. Black lines on the radiograph can be due to excessive bending. So avoid excessive bending. Proper washing and the manipulation or processing of the radiograph should be done on a clean surface. Tongue artifacts. Superimposition onto the dental surface. The tongue artifact is seen as a superimposition onto the dental structures. So, improper placement of the tongue during exposure can cause tongue artifacts. Adequate instruction should be given to the patient to keep the tongue behind the teeth and to avoid any interference from the tongue during exposure. Moisture contamination usually appears as a black artifact. This is caused due to the saliva contamination that adheres onto the film emulsion. Wipe or blot the film packet before you start processing to avoid moisture contamination. Phalangioma or the finger artifact. This appears as a radio-opaque artifact. It occurs due to improper positioning of the finger in front of the film. So, place the film So place the finger behind the film to avoid this artifact. Therefore, we can conclude faulty radiographs make loss of the valuable information that can be availed from them. Also, these faults can be rectified by being a little more careful while taking a radiograph, developing and fixing it. Care should be taken of the dark room and its surrounding. Thank you. Hope you had a good learning.